The most dangerous 5 seconds of your life might not feel dangerous at all. Right now, as you're watching this, someone your age is having a stroke. Not collapsing, not screaming, not falling to the floor, just sitting there, feeling a little off, wondering if they should lie down, have some water, or wait it out. And while they hesitate, their brain is dying, not figuratively, literally. Nearly 2 million brain cells every single minute. That's not a scare tactic, that's biology. And the scariest part isn't that strokes happen. The scariest part is that most of the damage happens because people wait. They don't wait because they're careless. They wait because strokes lie. They start small, quiet, easy to ignore. And by the time they become obvious, the window to stop the damage is already closing. In the next few minutes, I'm going to explain something that every person over 60 needs to understand. Something that could mean the difference between continuing to live independently and needing help for the rest of your life. There is a short window after a stroke begins, about 4 hours, where one simple decision can save your brain. Miss that window and no amount of medicine, therapy, or regret can undo what's lost. Once you understand this, you will never look at minor symptoms the same way again. I'm Dr. Robert Harrison, and I've spent decades watching how small delays during a stroke turn into permanent losses and how acting fast can change everything. I want to tell you about a man named Frank. Frank was 72 years old, retired, sharp-minded, and proud of the fact that he still did everything for himself. He woke up one morning feeling normal. He made coffee. He turned on the radio. While shaving, he noticed his right hand didn't move the way it usually did. Not weak exactly, just clumsy. He nicked himself twice and laughed it off. He told himself he probably slept on it wrong. That's what most people tell themselves. Frank finished shaving, got dressed, and sat down at the kitchen table. When his wife asked him a question, his words came out slightly slurred. Just slightly. Not enough to alarm her, not enough to alarm him. They both decided to keep an eye on it. 2 hours later, Frank tried to stand up and felt unsteady. His wife finally called for help. By the time he reached the hospital, the doctors already knew the truth. Frank had been having a stroke for hours. He survived. That's the part people focus on. But survival isn't the whole story. Frank never drove again. He needed help with basic tasks. His speech never fully returned. And here's the part that still hurts his family the most. If Frank had arrived at the hospital 1 hour earlier, his outcome would likely have been completely different. Same stroke, same age, same body, different decision, different life. That's because a stroke isn't one single moment. It's a process. When a blood vessel in the brain becomes blocked, the area beyond that blockage begins to suffocate. But brain cells don't all die at once. They die in stages. First they struggle, then they fail, then they die permanently. Modern medicine has learned how to interrupt that process, how to restore blood flow and save threatened brain tissue, but only if the patient arrives in time. Doctors call this the golden window, and it lasts roughly 4 to 4.5 hours from the moment the first symptom begins. Not from when it becomes unbearable, not from when you finally decide it's serious, from the very first sign, no matter how small. Inside that window, doctors can use powerful treatments that dissolve clots and reopen blocked vessels. Outside that window, those same treatments can become dangerous or useless. Once brain tissue dies, it does not regenerate. There is no reset button, no second chance. That's why time matters more in stroke than almost any other medical emergency. The tragedy is that most people don't miss the window because they don't care. They miss it because they don't recognize what's happening. Or worse, they recognize it but talk themselves out of acting. We've all been conditioned to believe that medical emergencies are dramatic. Chest-clutching pain, collapsing to the floor, alarms, and chaos. Strokes often don't look like that at the beginning. They whisper, a little numbness in the face, a hand that doesn't quite cooperate, a sentence that doesn't come out right, vision that seems blurry or doubled, a sudden wave of confusion that feels more annoying than frightening. And because the brain is the organ that interprets danger, a brain under attack is very bad at admitting something is wrong. It minimizes, it rationalizes. It says, let's wait and see. That internal voice is not wisdom. It's the stroke talking. You've probably heard of the FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. It's helpful, but it can also give people the wrong idea. They think if they don't have all the signs, they don't have a stroke. That's not true. Some strokes affect balance, some affect vision, some affect thinking or understanding. Some affect only one small area at first. Here's a better way to think about it. If anything about your face, arms, speech, vision, balance, or thinking suddenly changes in a way that feels unusual, unexplained, or wrong, that is your signal. Not to wait, not to rest, not to see if it improves. That is your signal to act immediately, because every minute you wait is another minute of irreversible brain damage. One of the most dangerous myths I hear is, "It wasn't that bad." People say this after the fact, looking back. They assume strokes announce themselves clearly. They don't. Many of the worst outcomes come from strokes that started mildly. People often tell me, "If I'd known it was a stroke, I would have gone right away." That's the point. You don't get certainty in real time, you get a choice. And the rule is simple. If it might be a stroke, treat it like one. You will never regret getting checked too early, but people regret waiting every single day. There's another reason waiting is so dangerous, especially for seniors. As we age, our blood vessels stiffen. Our risk factors accumulate quietly over decades. High blood pressure, diabetes, irregular heart rhythms, cholesterol issues. Even if you feel healthy, your brain is less forgiving of interruptions in blood flow than it once was. That doesn't mean strokes are inevitable. It means response time matters more than ever. The good news is that older adults who receive treatment quickly can recover remarkably well. I've seen people in their late 70s and 80s walk out of the hospital with minimal deficits because they arrived in time. Age does not disqualify you from recovery. Delay does. What breaks my heart as a physician isn't the strokes we can't stop. It's the ones we almost stopped. The ones where someone waited because they didn't want to bother anyone, because they didn't want to cause a scene, because they thought they were overreacting. "I didn't want to make a fuss" is one of the most damaging sentences in medicine. Emergency teams are never annoyed by stroke calls. They are grateful for them. What we fear are the patients who arrive too late when all we can do is manage the aftermath. Pride, politeness, and hesitation have no place in a stroke. Acting fast is not dramatic, it's responsible. And here's something most people don't realize yet, something we'll talk more about next. How you get to the hospital matters almost as much as how fast you decide to go. The moment you recognize a possible stroke, the clock is already running. What happens next can determine whether doctors can still help you or not. In the next part, I'm going to explain why driving yourself or having a family member drive, you can quietly sabotage your chances, even if it seems faster. I'll explain what happens behind the scenes when emergency services are involved and why those first words you say can change everything. I'll also show you the single biggest mistake families make in those early moments and how to avoid it. For now, I want you to hold on to this one truth. A stroke is not something you wait out. Waiting is not neutral. Waiting is a decision, and too often it's a decision that costs people their independence, their speech, their mobility, and their quality of life. 4 hours can feel like a long time when nothing feels terribly wrong. But in the brain, 4 hours can be the difference between recovery and permanent loss. Once you understand that, you stop debating, you stop negotiating, you act, and that action can save your brain. If there's one thing I want you to understand right now, it's this. What you do in the minutes after you suspect a stroke matters just as much as recognizing the symptoms in the first place. This is where many good intentions quietly turn into bad outcomes. People do the right thing halfway. They realize something is wrong, but then they hesitate on how to respond. They sit down instead of standing up. They call a family member instead of emergency services. They decide to just drive over instead of calling for help. And they don't realize that those choices, made calmly and logically in the moment, can completely change what doctors are able to do for them once they arrive. A stroke is not like most medical problems. It is not a situation where getting there eventually is good enough. Stroke treatment is a race against the clock, and every step between you and the hospital either speeds that race up or slows it down. One of the most common mistakes I see is people trying to be tough or independent. They say, I can still walk, I can still talk, I'll just have my spouse drive me. That feels reasonable, it feels faster, but it often works against you. When emergency services are involved, something critical happens before you ever reach the hospital. The moment a stroke is suspected, a system activates. The ambulance team begins evaluating you immediately. They note the exact time your symptoms started. They communicate directly with the emergency department. They alert the stroke team so they're ready the second you arrive. Imaging equipment is prepared. Specialists are notified. Time is shaved off every step. When you arrive by private car, none of that happens. You check in like everyone else. You wait. Precious minutes slip away. Those minutes are brain cells you don't get back. There's another reason driving yourself or being driven by a loved one is risky, and it's one people rarely consider. Strokes can worsen suddenly. Symptoms can escalate without warning. Someone who feels mostly okay can rapidly lose the ability to speak, move, or stay conscious. That's terrifying in a moving car with no medical support. Emergency responders are trained for those moments. Family members are not. Calling for help is not an overreaction. It is the safest and fastest path to treatment. When you make that call, the words you use matter more than you might think. You don't need to explain everything perfectly. You don't need to be calm or composed. What matters is clarity. Saying, I think this might be a stroke, immediately changes how your call is handled. If you can, say when the symptoms started, even if you're not completely sure, about 20 minutes ago, around breakfast time. That information helps doctors decide which treatments are safe for you. There are medications that can dissolve clots and restore blood flow, but they must be given within a specific time frame. Without that timeline, doctors may be forced to hold back, even if treatment could have helped. Families play a huge role here, and this is where another heartbreaking mistake often happens. Loved ones try to comfort instead of act. They say, let's see if it passes. You're probably just tired. Let's give it a little time. That instinct comes from love, but it can be devastating. Comfort during a stroke doesn't mean reassurance. It means action. The most loving thing you can do for someone you care about is to treat uncertainty as urgency. You are not accusing them of being sick. You are protecting their future. I want to talk for a moment about fear, because fear keeps people stuck. Many seniors worry about being embarrassed if it turns out to be nothing. They worry about medical bills. They worry about being a burden. Let me say this as clearly as I can. No emergency team, no doctor, no nurse will ever criticize you for coming in with stroke symptoms that turn out to be something else. Ever. What we do see far too often are people who apologize for wasting time while we're trying to explain permanent damage that didn't have to happen. The embarrassment you fear lasts minutes. The consequences of waiting can last a lifetime. Another thing people don't realize is that strokes don't always hurt. There may be no pain at all. That's one reason they're so deceptive. People associate danger with pain. When there's no pain, they downgrade the urgency. But stroke damage has nothing to do with pain signals. It's about oxygen deprivation. Brain tissue can be dying quietly while you feel relatively comfortable. Comfort is not safety. Calmness is not reassurance. Only speed changes outcomes. As we age, many of us become more patient, more tolerant, more willing to wait things out. That's often a strength. In the case of stroke, it's a liability. The traits that help you endure discomfort can work against you here. Strokes punish patience. They reward decisiveness. The people who recover best are not the ones who stay calm and quiet. They're the ones who act fast and speak up, even when they're unsure. I've watched families replay these moments over and over. If only we'd called sooner. If only we hadn't waited. That kind of regret is heavy, and it's unnecessary. You can remove it right now by making a simple agreement with yourself and the people around you. If something feels suddenly wrong with your face, arms, speech, vision, balance, or thinking, you act immediately. No debate, no negotiation, no delay. You don't need a diagnosis, you need momentum. In future conversations, we'll talk about reducing stroke risk, managing blood pressure, understanding heart rhythm issues, and building habits that protect your brain over time. All of that matters. But none of it matters if you miss the moment when intervention is still possible. Prevention helps you avoid strokes. Speed helps you survive them with your life intact. So let me leave you with this. A stroke is not just a medical emergency. It's a decision point, a fork in the road. One path leads to recovery, independence, and continuity. The other leads to limitations that no one ever plans for. The difference between those paths is often measured in minutes. You don't need to memorize statistics. You don't need to recognize every possible symptom. You only need to remember this. Sudden changes deserve immediate action. When in doubt, act. Your brain depends on it. And if this message stays with you, if it changes how quickly you respond for yourself or someone you love, then it has done its job. Because the goal isn't just to live longer, it's to live well.